Thank you. It was, quote, a shameful day in American history. This from the Democratic governor of Washington state talking about Thursday when the U.S. House voted to repeal Obamacare and replace it with a plan crafted by Republicans. Governor Inslee says it will threaten the health of millions of Americans, and he's joining us now. Welcome, Governor. Thanks for being with us. You are not happy with this bill, to say the least. I know you have said in your statement released after this vote that 700,000 people in your state will lose health care coverage. Tell us more about that.
Well, I think describing this as a shameful act is a fair description. I have cancer patients, children with cystic fibrosis, senior citizens on fixed income with respiratory and cardiac problems. And let's be clear, it is absolutely clear what this scam would do. It will kick those people off of health care. You said they were going to ditch Obamacare. The problem is they were ditching Washingtonians. We have estimated that there'll be about 700,000 of my citizens who today, if they've got a lump on their breast, they can have it treated. If they got high blood pressure, they can have it treated. And the Republicans have kicked them off of their health care. Now, that's a harsh thing to say, but unfortunately, it is true. And the image of these people celebrating, kicking people off health care, the most vulnerable amongst us, is very difficult to swallow, particularly the reason they did it. Let's be clear why they did it. They took $800 billion out of the health care of people, and they transferred it into the pockets of millionaires and billionaires in tax cuts for the people at the top 1% of the economic ladder. In what moral universe does it make sense to take a breast cancer survivor in Washington state, take her health care away, in order to transfer tax cuts to millionaires with a president who won't show us his tax return?
Governor, you were right. There are big tax cuts. There are big tax cuts in this bill. That is a fact. But Republicans would argue nobody is getting kicked off of their health care at this point. Those who support this bill, though, also believe federal government involvement is a barrier for driving health care costs down. That is one of the reasons this bill, they say, gives more power to the states, allowing more flexibility for people like yourself to design insurance plans that are specific for the population in your state, and that there would be funds set aside to help supplement coverage for the vulnerable where it's needed most. Why don't you see that working for you in your state?
There's a reason that the Republicans did not follow standard operating procedure. There is a reason that they voted on this without having this evaluated by the Congressional Budget Office. And the reason is this will clearly show this will kick off millions of people for their insurance. And here's the reason. You can't take $800 billion out of Medicaid that now is providing health insurance for people and eliminate the Medicaid expansion. We have 600,000 people who today, seniors on fixed income, lower income working people, people with cancer, 20,000 people already have received cancer treatment under Medicaid expansion. The Republicans seek to eliminate the Medicaid expansion program. That is simply unacceptable. Now, you are hearing voices all across the country raising a hue and a cry about this. And when these senators start to feel the heat, I think they're going to see the light, that it is not acceptable to eliminate Medicaid expansion. It's unfortunate, actually, I think, we've all become sort of very appropriately interested in the fact that they've removed protection for people from pre-existing conditions. But there's no debate that they will eliminate coverage over time for, in my state, about 600,000 people who are receiving Medicaid. These are working people. These are people who are providing health care for us today, providing food in our restaurants, driving trucks. Those folks deserve health care.
Right.
And it's working in my state.
I think it is important to mention that Medicaid currently covers about 70 million Americans. About 1 in 5 Americans have Medicaid. And in fact, this GOP plan, as it's proposed, Medicaid would be cut by 25% by 2026. But back to that issue of pre-existing conditions, because this was a big one for the lone congresswoman in your state who voted for the bill, Cathy McMorris Rodgers. She has a son with Down syndrome, which of course is a pre-existing condition, and this is very personal to her. Here's what she says. She says safety nets and protections are important and must be maintained for those who need them most. Our plan accomplishes this mission in 2 key ways. ways, by guaranteeing that access to health coverage can't be denied for people with pre-existing conditions, and by empowering states to innovate with new models for better patient outcomes at a lower cost. Why not take this challenge and run with it?
Well, we're very pleased that her child has insurance as a member of Congress. Children of Congress are pretty lucky, unlike millions of other Americans. The fact of the matter is we are succeeding in innovating in my state. Let me tell you what we've achieved by adopting innovative means of providing health care. Number one, we have 750,000 people have insurance. Number two, we have reduced the rate of medical inflation from 16% to 6%. We have reduced the uncompensated care by 60%. We have created 50,000 new jobs. And the reason we have been so successful in my state is we are bringing innovation. We are integrating mental and physical health so you can get treatment in the same place. We have new ways of buying medical care where we get value rather than just volume. We want quality rather than quantity. We want people to have health coaches so that they can live more healthier lives. All of those things are succeeding in reducing the rate of medical inflation. And we have a waiver from the federal government under the existing law to do that. So the point is, we can have our cake and eat it too here, which is reduce health care costs, but you don't have to kick 600,000 people who aren't lucky enough to have a parent who's in Congress to have insurance. And I find this a moral abomination to not listen to my state. Our insurance commissioner wrote this congresswoman and told her that she was going to be kicking off 600,000 people off health insurance in my state. She did not listen to that. We don't find this acceptable. We hope the Senate will do much better. I know our two Democratic senators will insist that we do much better than this.
All right, Governor Jay Inslee, we appreciate your time. Thanks for coming on.
You bet. Keep fighting.